Pharmacology is a critical component of the Family Nurse Practitioner Certification exam. It is not just one of many topics. It is the thread that connects almost every clinical scenario you will encounter. When you see a question about a patient with hypertension, diabetes, or an infection, the core of that question often revolves around selecting the correct medication. This is because your role as an FNP is heavily centered on prescriptive authority. The exam boards know this, and they design their questions to ensure you are safe, effective, and knowledgeable in your prescribing practices. Therefore, dedicating a significant portion of your study time to pharmacology is not just recommended, it is absolutely essential for success. Think of pharmacology as the language of clinical management. Every diagnosis you make will likely lead to a treatment plan, and that plan frequently includes medication. The exam will test your ability to speak this language fluently. It will ask you to do more than just name a drug for a disease. You will need to understand why one drug is chosen over another for a specific patient. Factors like age, comorbidities, potential drug interactions, and even cost can influence your decision. Your grasp of these nuances demonstrates advanced practice competency, which is precisely what the certification exam is designed to measure. A strong foundation in pharmacology is a strong foundation for passing the exam. The sheer volume of information in pharmacology can feel overwhelming. There are hundreds of drugs, dozens of classes, and countless side effects to learn. It is easy to feel lost in the details and wonder where to even begin. However, the key is not to memorize every single drug ever made. The goal is to understand the major drug classes, their mechanisms of action, and their most common applications. By focusing on these high-yield topics, you can study smarter, not just harder. This strategic approach will help you build the confidence you need to tackle any pharmacology-based question that comes your way on test day. Remember that every hour you invest in studying pharmacology pays dividends across the entire exam. A deep understanding of medications will help you answer questions not only in the pharmacology domain but also in areas like adult health, pediatrics, and women's health. When you can confidently connect a patient's condition to the appropriate pharmacologic intervention, you are demonstrating the critical thinking skills of a competent FNP. This is your opportunity to show the examiners that you are ready to practice safely and effectively. Let's begin by breaking down the most important areas to focus on for your success. When preparing for your FNP exam, it is crucial to prioritize certain drug classes that appear frequently. Cardiovascular medications are at the top of this list. You must have a solid understanding of antihypertensives, as hypertension is a common primary care condition. This includes ACE inhibitors, the prils, angiotensin II receptor blockers or ARBs, the sartans, beta blockers, the olols, and calcium channel blockers. Know the first-line choices for different patient populations, such as which drugs are preferred for patients with both hypertension and diabetes. Similarly, be well-versed in lipid-lowering agents, particularly the statins, as they are fundamental in managing cardiovascular risk. Next, you must focus on medications for endocrine disorders with a special emphasis on diabetes management. The exam will almost certainly test your knowledge of oral anti-diabetic agents and insulin. Understand the difference between metformin, sulfonylureas, and newer classes like SGLT2 inhibitors and GLP-1 receptor agonists. Know their mechanisms of action and which ones carry a risk of hypoglycemia. Thyroid medications such as levothyroxine for hypothyroidism are also a high-yield topic. Be prepared to answer questions about proper dosing, monitoring TSH levels, and patient education regarding how to take the medication correctly for optimal absorption. Antimicrobials represent another massive and essential category. You do not need to memorize every antibiotic, but you should know the major classes and their primary indications. For example, know which pathogens are typically covered by penicillins, cephalosporins, macrolides, and fluoroquinolones. Be very familiar with the treatment guidelines for common infections seen in primary care, such as otitis media, sinusitis, urinary tract infections, and community-acquired pneumonia. Understanding patterns of antibiotic resistance and when to choose a broad spectrum versus a narrow spectrum agent is a key competency that is often tested. Finally, do not neglect psychotropic medications and respiratory drugs. For mental health, be comfortable with the first-line treatments for depression and anxiety, which are typically SSRIs and SNRIs. Understand their common side effects and the time it takes for them to become effective. For respiratory conditions, you must know the difference between rescue inhalers like albuterol and controller inhalers like inhaled corticosteroids for asthma and COPD. Knowing the stepwise approach to managing these chronic conditions is critical. Mastering these key drug classes will provide you with a powerful advantage on your FNP exam. Knowing the right drug to prescribe is only half the battle. Understanding its potential side effects is equally important for patient safety and exam success. The certification exam will test your ability to recognize and manage common and serious adverse drug reactions. For example, you must know that ACE inhibitors can cause a persistent, dry cough and, more seriously, life-threatening angioedema. You should be able to identify this side effect and know that the correct action is to discontinue the drug immediately. Similarly, you must associate statins with the risk of myopathy and rhabdomyolysis and know to instruct patients to report any unexplained muscle pain. Patient education is inextricably linked to managing side effects. Your role as an FNP involves teaching patients how to take their medications safely and what to watch for. For instance, when prescribing metformin, you should instruct the patient to take it with food to minimize gastrointestinal upset. When starting an SSRI for depression, it is crucial to counsel the patient that they may not feel the full benefits for several weeks and to report any worsening mood or suicidal thoughts. This practical, real-world knowledge is exactly what the exam aims to assess, as it reflects the daily responsibilities of a practicing nurse practitioner. Let's consider another critical example: anticoagulants like warfarin. Patient teaching for this medication is extensive and frequently tested. You must be able to explain the importance of regular INR monitoring, the need for a consistent intake of vitamin K, and the signs of bleeding to watch for. You should also be able to advise patients on what to do if they miss a dose. This level of detailed instruction is vital for preventing serious complications. The exam questions will often present a clinical scenario and ask you to identify the most important piece of patient education to provide in that specific context. To effectively learn this material, create study aids that link drugs to their key side effects and teaching points. Flashcards are an excellent tool for this. On one side, write the drug name, for example, furosemide. On the other side, list its class, loop diuretic, major side effects like hypokalemia, ototoxicity, and essential patient teaching such as monitor for muscle cramps, take in the morning to prevent nocturia, stand up slowly to avoid dizziness. Regularly reviewing these connections will solidify the information in your memory, making it second nature to you during the high-pressure environment of the exam. Studying for the pharmacology portion of the FNP exam requires more than just passive reading. It demands active learning and clever memory aids. Mnemonics are a powerful tool for recalling complex information under pressure. For instance, to remember the side effects of beta blockers, you can use the 4 B's: bradycardia, bronchoconstriction, blood pressure, and blood sugar. For common antibiotics, you might create a silly sentence or acronym that helps you link a drug class to its primary use. These simple memory tricks can save you valuable time during the exam and help you confidently select the correct answer. In addition to mnemonics, consistent practice with exam-style questions is non-negotiable. It is through practice questions that you learn how the concepts are tested. You will begin to recognize patterns in the way questions are framed and the types of distractors that are used. Find a high-quality question bank and commit to doing a set number of pharmacology questions each day. Do not just focus on whether you got the answer right or wrong. Instead, carefully read the rationale for every option. Understanding why the incorrect answers are wrong is just as educational as knowing why the correct answer is right. This deepens your critical thinking skills. As you progress in your studies, remember to integrate your pharmacology knowledge into complete clinical pictures. Do not study drugs in isolation. Instead, connect them to the diseases they treat. When you study hypertension, review all the first-line antihypertensive drug classes at the same time. When you review community-acquired pneumonia, review the recommended antibiotics. This integrated approach mirrors how you will think in clinical practice and how the exam will present information. It helps you build a strong, interconnected web of knowledge rather than a list of disconnected facts, making recall much more efficient and reliable. Finally, be kind to yourself during this challenging process. Preparing for the FNP board exam is a marathon, not a sprint. It is normal to feel overwhelmed at times by the sheer volume of pharmacology content. Take regular breaks, ensure you get enough sleep, and celebrate small victories along the way. Your hard work, dedication, and strategic approach to studying will pay off. You have made it through a rigorous graduate program, and you have the knowledge and capability to succeed. Trust in your preparation, stay consistent, and walk into that testing center with the confidence that you are ready to excel.